way care close to home is going to work is by actually doing what it says, by bringing the care that patients receive back towards their home setting or their residential setting, so nearer to their base, if you like. What excites me the most about care close to home is being able to be directly involved in that patient care. So when my patients are admitted to hospital, sometimes, and not always, you lose touch with what's happening. By bringing care back to the patient's house, back into the community, we're more comfortable with community services, community providers, and so I can have a direct role in that patient's recovery, further enhancing my doctor-patient relationship.
I've got osteoarthritis, and I'm afraid I've got it in my feet and my hands and all down my back and spine. So it was one morning early, and I got out of bed to go to the bathroom, and I just fell. I don't think I was sleepy. I think probably my feet just gave way. And that was it, in a moment. And I'd broken my hip. With the arthritis, it's been difficult for me because obviously I need more help. And it was so difficult in hospital because I knew they were busy, but I had to ask them for help. And they tried so hard. So it was a very difficult time.
Care close to home has been fantastic for Mrs. Matthews. The story for her was that she was admitted to hospital, and actually the way to make sure she was out of hospital and rehabilitating and recovering in a home setting was by using a care close to home sort of package. So she is now getting all the help and care she needs to recover back to normal in her house, and I'm sure she's happy with that. As a GP, I'm happy with that because I know that actually she's going to recover better, and I have more insight and I can actually oversight of it as well.
I believe that care close to home will be a great benefit to the patient. At present, the system is rather complex for the patient, whereby if they have multiple medical needs that need to be treated by medical professionals, they're often seen in multiple clinics at the hospital, which are often further away from the patient. They need to travel relatively long distances. So by bringing that care out towards them in the community, that will improve their journey and improve the patient experience. It's all too easy for us as professionals, commissioners, to assume what patients want and what patients need. But unless we hear that true patient voice and about what they really want from the services, we can't really understand what they really will need or what their expectations are. So in the new model, where we've actively involved patients in that process, and we've had many public consultations to gain their voice, a particular example is the Big Care debate, where we had multiple meetings to discuss with patients their needs and wants, and we've fully incorporated that into our plans going forward. And I think that really gets the essence of patient care and what patients want and expect.
Increasing numbers of people have long-term medical conditions that require regular review, checks on medication, sometimes quite sophisticated delivery of care. And because people often have more than one long-term condition, it means that their care is very complicated in some instances, and that's replicated across the country. And with larger numbers of people needing that care, we have to try to change the way we deliver services, otherwise the services we've got will not be able to cope with the increasing needs of the population they serve. So it's about changing the way we do things to make sure we continue to deliver the high quality care that we all want to deliver to our local population.
Just tuck and bend your knee, your poor knee.
Right. I think it's made all the difference in the world. I think it's helped my husband and I so much to cope. It's stopped both of us from worrying about each other and about ourselves. And I think if we hadn't had the ladies from Care from Home, we would have really struggled. They've brought a lot of happiness in. They're always smiling. They've brought a lot of comfort. You can talk to them while you're shut in the bathroom, whereas you don't want to unload everything onto your husband. And I think the sheer kindness and the consideration that we have had from them, as well as the NHS physios and everybody who's come home to help us, has been a real joy. And our life would have been very, very much more difficult without them.
I'm really excited about Care Closer to Home because it provides an opportunity to bring together in partnership a number of the health organisations which previously have operated largely independently. We need those organisations to be working very, very closely together. I think the opportunity for those organisations to be really joined up, really coordinated, and particularly to be really focused on the outcomes and the experience of care for individual people as much as they are for their own organisation is really exciting, and that will change the way our health service relates to people locally and change it for the better.
If I had to talk to somebody who may have to have the same care close to home, I would thoroughly recommend it. I really would, because I'm perfectly sure, as I didn't, most people don't know about it, and more people should, because when I went into hospital I was very frightened. I was frightened of what would happen about the care and about getting home, and if I'd known about your people with the care close to home, I wouldn't have worried so much. And once I've got here, I would tell this prospective patient, you'll get the help you need. They don't mind you asking, which is wonderful, and it really makes life possible, both for you and your husband. So thank you for doing it.